Okay, go Kim.
Hey, thank you for joining us. This is Adrienne Trigg, and Adrienne's going to talk about barriers to healthcare and how to overcome it. Adrienne is one of our CC4C moms, and so she's deep in the trenches of the healthcare issues. So, Adrienne, go ahead.
All right, well, thank you for having me today. The presentation I have, as you'll see, is I've presented for the past 2 semesters in the UT Public Health courses. And Hayden is usually there with our nurse Neil, and he is in the center of this picture. That's Hayden, and our nurse Neil's in green with his son there. And these are just some pictures. Usually we open with a good joke, but I don't have those since Hayden's not here today. So these are just some pictures of who Hayden is, since I'm usually known as Hayden's mom. This is showing on the bottom of the screen the football team. He's been part of Champions for Children. And since he's been there for 2 years, this was his picture last year, just as they were coming out on the field, and he was honorary captain. So wanted to give that introduction of whom I'm speaking about today. And it's a great honor to be here. As I'd mentioned, I've been speaking more than I ever thought possible, more than I ever wanted to. This next picture is some things that really took place last year. Just last week, though, I did go and have public testimony on the Senate floor again. So as much as I would like to be done talking about healthcare, it seems like this is something that is going to continue on for some time. So last year provided us with a lot of opportunity and more public speaking than I ever imagined on healthcare. I testified in the Senate, as I'd mentioned, in the House of Representatives, in the Texas State Department of Health and Human Services, on many local TV networks, and then we had the opportunity to talk live on MSNBC on a national platform regarding national healthcare. So most of my experience has been with our local healthcare and the changes that took place. And that was only because the law changed as soon as we got out of one of Hayden's major surgeries, and we had just participated in CC4C. Medicaid changed in the state of Texas. Medicaid, Hayden is on Medicaid. Some of you have Medicaid, some of you don't. Medicaid's very narrowly defined for disabilities, and he's on Medicaid due to his disabilities and not on our income. And he's been on Medicaid since birth. And those changes happened last year, where the state took the Medicaid money and gave those funds to different private insurance companies. So there was quite a bit of disruption in that change. It had never happened before. So we were kind of thrown into that new program, and there was a lot to learn. So that's why we had a lot of testimony about how it had impacted us. So this next slide is just a picture of the field. This picture really is a visual analogy of the path that I feel that I'm currently on. It is not unlike my agricultural upbringing. When I look at this picture, it is of a remote landscape. The road is not well defined. It is rocky and uncertain. The environment requires a lot of manual labor and hard work. And while continuing on this road, one will certainly face steep challenges at times, but I can find beauty all along the way if my attention is in tune with the majesty of the surroundings. So I look at this and I think of a lot of our situations are extraordinarily difficult, and they are uncertain, and they are rocky roads for a lot of us. And I think that you can relate and look at that picture and make your own analogy. This I had mentioned was production for UT Public Health. And so one of the things that the public health students look at as they are future policymakers are the problems and successes in obtaining information on healthcare. So that's where I'm starting. And one of the first things I do is I just define what spina bifida is. And that's the major diagnosis for Hayden. And so when I'm looking and making this more appropriate to the families that are out there, I think it's just really advocating and educating on what your rare disease is, and helping people understand what that is. So spina bifida is a general term used to describe a variety of neural tube defects, meaning split spine in Latin. spina bifida is caused by a complex interaction of both genetic and environmental influences that ultimately affect any given pregnancy. The genetic influences remain poorly understood other than commonalities of certain genes that are just recently identified, maternal obesity, as well as people of Irish and Hispanic descent. So the genetic influences is just poorly understood, but that's what they have understood. And then environmental influences are completely not understood. I will get into that in a little bit. When I thought of spina bifida, when we got that diagnosis, I thought of scoliosis. He has that as well, but I didn't understand what spina bifida was. So that's just a broad overview of the definition. The environmental influences have been identified, such as a lack of folate intake and diet absorption. The use of seizure medications during pregnancy can cause spina bifida. And then there's also a 20-year research study that was done by Dr. Faulkner on fumonisin. It's mold spores in corn. And that study was done in the Valley in Texas, and it was a 20-year study. And this professor, this doctor that worked on this part of this research study is now the professor at UT teaching public health. So it's very interesting that she is very much an expert in public health and specifically spina bifida. She's the one that uncovered the mold spores that are on corn. And what's really interesting, this 20-year study, and down in the valley, a lot of spina bifida was popping up in clusters, and kids with anencephaly and lots of birth defects were happening, and they couldn't identify. So they studied for 20 years, and they found that there's a lot of masa eaten. And so the people down in the valley were eating corn masa that they were making themselves. Well, different masa at different plants commercially is produced where they can boil the corn, and it gets rid of these mold spores. But for some of these smaller communities where they make their own corn masa, they weren't boiling the corn, getting rid of these mold spores. And they found a direct link with these mold spores making neural tube defects. So it took 20 years to identify that, but we're sure glad that's the only study that has been done in the United States since then. And there's not any studies currently being done. So that's the only thing that has ever been done to identify the environmental influences. Long story there. But the CDC recommends that all women take 4 milligrams of folic acid at least 1 month prior to conception. Neural tube defects occur prior to the woman missing her first period and before she even realizes she's pregnant. Unfortunately, even if all women do this, 30% of neural tube defect cases would still occur. So I'm one of the 30%, yay for me. Hayden was conceived via in vitro fertilization. So I was very well informed of my nutritional needs, my diet, my exercise, and did a whole host of all the things that I should have done, and still ended up with a neural tube defect. And so there's huge risks that are not identified on what causes these neural tube defects that are lifelong. This next screen shows how the embryo develops. And as I had mentioned, neural tube defects occur before most people even know that they're pregnant or miss a period. So that's why folic acid that has been identified is so important to get in your diet. You pee it out every day. So it's not something that you can build up over time. It's something that you need to take every single day. And so I stress that for family members or for any young people that are trying to conceive, or even that are sexually active that may not be trying to conceive. Just taking a prenatal gives you the minimum dose of folic acid. Here's at 21 days, and it shows the neural tube developing. The head is at the top, and that is usually the last thing to close, along with the bottom and the sacrum. So at 22 days, you show that the head has not yet fully closed on that neural tube. And then at 22 days, you can start to identify already that the neural tube is going to have spina bifida. There's a hole, and that's identified at 28 days, very clearly at 28 days, the hole in that neural tube. And at the top of the neural tube, there's some other holes that may close later or not at all. And Hayden's has not closed at the top of his spine and at the bottom of his spine. So he's the winner on all of those examples. And on the right, these are some big words: spina bifida occulta, meningocele, and myelomeningocele. Most people that with spina bifida, 90% get diagnosed in a car accident where a chiropractor would say that you have spina bifida, and it's just a weakened spine. Meningocele is where the spine is actually on the outside of your body when you're born, and then myelomeningocele is where the nerve endings also come out with the spine and create quite a bit of damage. These next pictures are graphic, so I'm just warning you now before I switch over. This is what's done with spina bifida. Right now, we were part of a study that was a 7-year study, but it's now common practice throughout the United States, where people with spina bifida have the option and possibility of being twice born. The in utero surgery, where that's the womb that's actually taken out of the stomach, and the womb is cut, repair is done in utero, it's patched, and then it goes back in, and it's significantly reduced nerve damage to the children, and they have not needed brain shunts. They've been able to walk. Market improvements if you are able to get that surgery. It's very risky. The study, mothers had died undergoing it, children had died. There's prematurity is the biggest risk of the surgery, but the rewards are quite great. And then this is pictures of Hayden when he was born. His spine was on the outside of his body. That's the lesion. And it was closed at birth. He had a brain shunt, and then his spine was closed at birth. So those are just some pictures to explain what spina bifida looks like and what that process was, to give a little background. And then from that day on, we started to really dive into what is this going to cost us. Those surgeries that Hayden had were not cheap. When we got the diagnosis, so part of healthcare is really starts at diagnosis. If you're fortunate enough to get a diagnosis, as we have been, we've had many diagnoses, and I know a lot of people don't have those that are part of this conversation. But when you get a diagnosis, or when you don't, when you don't have a diagnosis, you're just swimming in a sea. When you get a diagnosis, it's often like you're drinking from a fire hose. There's cultural stigma, there's fear, there's blame. How did this come about? What was your part in it? What's going to happen? What is the stigma associated with it? And then, as you all know, and I'm speaking to an audience here that knows better than anyone, caregivers are given very little support. And finding answers as to why the diagnosis happened is one of the hardest things that you could search out possibly your entire life. Finding prenatal answers onto how to prevent it from happening, and also socioeconomic barriers. So if you have more children, you definitely want to know how to prevent it from happening so that your future children don't have to go through the same suffering or tribulations that your current child has, and then society as a whole, that you want to see a way to prevent this. Could this be preventable so that other people don't have to suffer this as well? And then there's socioeconomic barriers to getting health care. Some that are less fortunate maybe not have the educational opportunities to know how to advocate for themselves. They might have language barriers. There is just the confidence part of not knowing how to go about asking for the how and what to do. And then finding timely answers on what can be done to make the diagnosis achieve your best outcome. So there's the why, the how, and the what that are some big problems that I've encountered as well. One of the things that started when Hayden's 9, and so 9 years ago at the time, I think that's right when Facebook was really coming out. There wasn't a really large way to connect. That was a problem. And so when we went and got our diagnosis, the HIPAA privacy laws have kept doctors from referring us to other supportive families. And when you're rare, it's very hard to reach out to say, what did you do? What was your thought process? How have you gotten assistance? Just knowing others on what they've done, and so that you're not a pioneer. And HIPAA privacy laws, while they're understandable that that is one of the barriers that we had, we didn't have any social ways to reach out to connect with others. And there's no treatment for very rare diagnoses. And in rare cases, Hayden was diagnosed with Arnold-Chiari brain malformation, Arnold-Chiari 4 specifically, which is not compatible with life. And his diagnosis had to change because he is alive. But if you look at it on a clinical standpoint and looking at his images, he is Arnold-Chiari 4, which, as I had mentioned, is not compatible with life. So to find anyone that has gone through that is really impossible because they're not living. So you could read studies. And so having that health care provided is so difficult to find. And that, as I had mentioned, that there are no current studies or clinical trials that are available for pediatric spina bifida patients at this time. We were part of numerous national trials when Hayden was in utero and was born. As I had shown you the picture, there was the mom study that was being done that was 7 years. And then there is currently, which is very promising finally, a stem cell trial being done at Duke. I've been part of communicating with the lead researchers for 5 years, trying to get Hayden to be part of those stem cell trials. We've donated his medical, siblings, medical cord blood and other things to participate in future stem cell trials because we have gone out of the country when he was full and had that done. It was very successful. So we're hopeful that the US is now getting these clinical trials where that they can roll this treatment out. And then qualifying for Medicaid is something else that is a very difficult thing to do. Qualifying for anything through Social Security office and qualifying for Medicaid required that we stayed in a nursing home at birth. It required 6 months worth of paperwork and collecting information and getting denials and really having to fight our case. And as I am putting out here, that we did have to stay in a nursing home. And we got so many denials from primary insurance at the time that he was born with his pre-existing conditions that he maxed out before we were even able to take him home from the hospital. He had maxed out on his lifetime benefits. So we are greatly appreciative that because of his many disabilities that he qualified for the state waiver program for Medicaid. And then right now, what we are experiencing with problems with access to healthcare is access to our specialists. We're here in Austin with Dell Children's. Hayden was the poster child for all of Seton Networks in 2009 because of the coordination of complex care that he received was very successful. We had direct access to his neurosurgeon, to his urologist, and we still do, honestly. They've given us their cell phones. But as Dell has grown and as Seton is now a teaching hospital, I just got a tour of the new teaching hospital on Tuesday. And as they're growing, you have more layers with nurses, new nurse practitioners, new physician's assistants. Now we have all of these residents, where before it was just the doctor. What I would highly recommend to all of you in Austin is that if you do work with Seton Network, is that you get some notes put in to your billing and to their screen when you go through the ER, that you don't have to go through all of these layers. You say that you have a highly complex child and that you want to speak directly with doctors and that you don't prefer any residents. So you're not telling your story over and over and over again. So it's taken us years to realize that we have that opportunity to say, we don't allow residents. We don't allow all of these other layers because he's so complex. We request that he just see the doctors primarily. So we advocate for that. And what are some of these causes to access problems? As I had mentioned, causes is growth. You don't have the exact opportunity to go directly to your doctor. And diagnosis is a huge access problem. People don't know how to treat you if you don't have the exact diagnosis and you're giving symptoms. Lack of medical terminology, knowledge. We have so many diagnoses. We got another one just the other day. If you don't really understand the knowledge, you don't know what to ask for. If you don't know the terminology, and just the speak, that's really, really a hard thing. And then the stigma is an access problem. Culturally, some cultures view disability as a stigma, so it holds you back from asking for help. And there's a stigma that we need to eliminate there. I'm mentioning again, caregivers are given very little support, finding answers to why this happened, finding answers to how it happened, and finding timely answers as to what can I do to make it better. Timely can be life critical in a lot of situations. I put this picture behind to show you and to teach UT public health students about equity and versus equality. The picture on the left is about equality. So these are people looking over a fence to watch an athletic event taking place. You give everyone a box, they should be able to see over the fence. That's equally distributed. You give the adult a box, they can easily see over the fence. You give a child a box, it doesn't quite give them the same advantage, but they can still see over the fence. You can see that the box is of no benefit to the child in the wheelchair. And this is what equity is on the right. Equity shows that everyone receives the same outcome, which is the view over the fence. But you have to give a lot more support to certain individuals where others need no support to achieve the same outcome. So I like that visual because it shows that while we think we're treating people equally, it really does not give them the same outcome that they each need or deserve. And so some people need a lot more than others just to get the same equal opportunity. Let me go to my next slide. And what are the causes? As I had mentioned, HIPAA privacy laws. There's no treatment for diagnosis in rare cases. We need more funded research by the Undiagnosed Network. And doctors, by contacting them directly, is what I found throughout the country, is something that we're looking for specifically, is I will get on websites that show what current studies are out there, and I will contact, and their phone numbers are listed for the research facilities, and oftentimes the doctors, and you can speak directly to them, and I'll say, this is the type of research we're needing, and I'll just start making calls. Or I've put different doctors in contact from the University of California, San Diego, and put Duke in touch and said, here's similar researchers that are doing similar things across the country, and can you not collaborate? Or if a research project is finishing, saying, here's the next step, because they're often looking to, keep their jobs and keep their funding going and doing their next step of research. So if you can talk to the doctors and saying, here's what you're looking for, these researchers are looking to keeping up on their research, because that's how they're paid. So I know that just research what is being done and contacting them directly is one of the ways to get some access. And there's no studies or clinical trials. So there's very little scientist collaboration, because I had mentioned sometimes they're in competition, and it's also sometimes hard to participate in these trials because they require travel. And qualifying for insurance is an extremely difficult thing. There's a lot of red tape, and it's very difficult for families to, once qualify, also to know how to stay qualified. And denials from insurance with pre-existing conditions is something that is very real and can happen again with new legislation, and that's often being proposed. And all of these changes are continually being proposed, and we need to stay up on top of what's good legislation and what's bad legislation. And access to specialists with layers of staff. Depending on where you live, you might live in a smaller area or have a closer knit community with doctors, but as Austin continues to grow, access to those specialists is going to become more difficult as their patient population grows. This next slide is, what are the recommendations to overcome all those problems? So I think the best thing that we can do is to ask for help. And part of the things like what CC4C is doing with these Zoom conferences is sometimes we don't even know what to ask for. We don't know a diagnosis. We don't know the terminology. We don't know that there is help available out there. And by joining these Zoom conferences, by asking for help, saying, here's where we're stuck, that is the hardest thing, is to say, I've done what I can do. I have no idea what is out there. Can you help me? And really knowing where to ask is the hard thing, and knowing who to ask and to seek that advice through. And seek secondary insurance. We sought Medicaid, we qualify for Medicaid. It's gotten much more difficult in the state of Texas. There are 170,000 kids on the waiting list right now. They only opened up 200 spots for the next 2 years. So unless kids move or pass away, those spots don't open up. There are secondary insurance options available on the private market. And I know from some friends that have severely autistic children that they have found that buying secondary insurance has saved them. They've done the numbers and has saved them in the long run. So while it's quite costly to buy the secondary insurance, they've been afforded to have a lot more services offered versus paying as they go. Another thing that I want you to know is that knowing your rights, that disability is protected under the law, and that you have to know your rights and stand up for them, and that you have rights on a commercial settings when you're out in public, as well as in the school settings, that you have a lot of rights, and that you are your best advocate for your children. And to realize that there are no other advocates better than you. I kept thinking, certainly these doctors know better. Certainly someone's going to come and be our rescue and tell us everything that we need to know, and that they'll take care of it for us because they're the professionals in the medical field. And what I found out is actually you're the advocate, you are the professional, you know more than the doctors, and those doctors that are the most helpful. And what I found even with our pediatrician, she says, you know more about your child and you know more about their unusual and rare diagnosis than I ever will, because they're a generalist and they've studied all of these general fields. And so even just explaining it to people in the ER or to specialists, because you live it day to day, you know these symptoms, you know this child and their personalities, that there really is no other better advocate. And explaining that to extended family, what I have found has been the hardest thing, because they keep thinking, who's advocating for you? And when I say that's the role that I've now taken on as my full-time job, it's really hard to explain that to extended family. But make friends, join other support groups. This picture is Spina Bifida Day at Morgan's Wonderland. If you haven't been there, highly recommend it. It's wonderful. But join as many support groups as you can, just to help expand your knowledge and to not feel isolated. And I've learned that my faith defeats fear every single time. So that's the best thing that I can say, is rely on your faith, whatever that may be. It'll get you through your hardest times. And then some other ways to overcome these problems on access to healthcare is to recognize and distinguish between good doctors and bad doctors. Good doctors collaborate. They don't have an ego. If you want more opinions on how to go about non-standard medical issues, they will collaborate and they will take time and they will respect you, and you will respect them more for that. This is the picture of coordinated care that was on many billboards in every hospital in Seton in 2009, because we had such great care. This was our coordinated care conference, and we did have collaborations. We had 2 neurosurgeons working on Hayden. Dr. Georges, who opened up Seton Medical's neurosurgery department. Dr. Lee is on the right, and he helped on the initial closure with Hayden. So we feel very confident that if we are not able to see Dr. George, that we know that we have a very good backup with Dr. Lee, and we have a good rapport with him, that they do collaborate on very rare cases. And then we had the coordinated effort with our nurse that's behind me in this picture, and with the NICU neonatal team. So they all spoke together and they were very transparent on what was going to be the process of taking care of Hayden. So I wanted to show you that doctors help you get stable, but don't tell you how to live day to day. And that's where the healing comes from. They help you get stable, but the healing day to day is something that we need support groups for, that we need other organizations. And that leads into my next slide that I've been so proud to show. And this is where I show that this is really where the healing takes place. And CC4C has been so wonderful in helping us all to be advocate for us, to help us to learn how to advocate, to practice be bold, to learn how to do our research and other avenues that I had no idea were available. That it's made us to have to be humble in our learning and to know that we don't know so many things, and to get crisis counseling. That has been something that I've learned, that we can't just take this all on as parents and caregivers. We're given such little support. We go through so many crises with our children that we need to learn how to foster our whole family. And CC4C has done that. They've taken and fostered our whole family and made that such a healthy outcome for any trials that we've ever gone through. And we've gone through many with the past year. When Hayden first started with CC4C, it was really a rocky road. He's had a very healthy year this year, and he's been very stable to help maintain a healthy lifestyle. So I recommend that maintaining a healthy lifestyle is one of the hardest things that we can all strive to do every day. Taking care of our kids with these rare diagnoses can become overwhelming and something that we focus on, but we can't take care of them unless we take care of ourselves. And we definitely can't take care of our other children or our other family members unless we really take care of ourselves first. So I can't go into how to do that, or I don't pretend to be an expert on that, but I'm very grateful for CC4C. And I show this to UT, and I say that the local organizations have been the most beneficial in just showing where resources can be, and giving an optimistic outlook of hope. This is something that I took a picture of one of the days of many that I was advocating in the Capitol. And this was of education and advocacy. And that's what I think that we're all here doing, is we're educating ourselves, and then we have to advocate. And advocacy, as I kept saying, is I wish this would end, that I wouldn't need to be public in our story, that I wouldn't have to tell our story so many times, that I could go to a life of being private. But I know that advocacy will not end until these rare diagnoses end. So we need to advocate for the rare and most vulnerable among us. But this was a history of the University of Texas in Arlington. And this shows the pioneers, because oftentimes I feel like I'm a pioneer and I'm doing this all alone, that we are reinventing the wheel, and that we have to keep educating people because the masses just don't know. And how do we advocate policymakers and people that are really implementing and affecting our day-to-day lives? So these are some of the pioneers that came, and this was a history of accessibility at the University of Texas in Arlington. And those were some of the pioneers that were, the University of Arlington is up in Dallas, not in Austin, but they were one of the first campuses to be accessible and to take disabled students. So I was really proud of that. And they had their presentation that day that I was there. So I was very excited to just take some quick pictures. This next one shows about Arlington ISD and how far we've come. And I definitely have gratitude for how far we've come. And polio, and this is talking about in the 60s, after being paralyzed by polio at 9, Sam, and so my son's also 9, and so I very much relate to this. Sam Province can no longer access public schools. Instead, his teacher periodically came to his house. And there may be some of you that have education for your children at home, and the state does not require that they get the same amount of education at home versus what they could get if they're in the school. And it's great that the teachers can come home and do home health education, but it's so much more beneficial if the child is able to go to school and stay healthy and interact with their peers. So I'm very grateful that Hayden in a wheelchair is able to access his school and have an education and be with his peers. In this next picture, it says paralyzed due to polio at 5. Joseph Rowe used his feet to paint a picture and build rockets in his garage. Although he dreamed of majoring in engineering at UTA, he was told that it was too dangerous to be allowed in science labs. So his disability rights were not protected. He was not allowed in school. Rowe graduated from the University of Texas in Arlington in the 70s and was the first business major with a 4.0. And when we think, I get emotional when I think about Hawkins and what he's been able to do in bringing awareness of allowing people with disabilities. I got to get it together here, sorry. But allowing people with disabilities to be able to attend school. showing that they are valuable, that they have contributions. So it's important, I think, to recognize where people come from, but also that we still have to continue to advocate, that there's still room, that we still have ways that we have to go and grow. So you wonder, how well has this advocacy worked? It's gotten kids with polio really has been eradicated. My grandfather had polio, but my son, ironically, is now in a wheelchair like my grandfather was, and he's able to go to school. How well has the advocacy worked? So I have this quote by Mother Teresa. It says, "I'm a little pencil in God's hands. He does the thinking. He does the writing. He does everything. And sometimes it is really hard because it's a broken pencil and he has to sharpen it a little more." And I keep getting emotional when I'm talking to my computer screen. But we all feel that we're broken at times, not knowing where to turn. And I think by being humble and relying on your faith, whatever it is, knowing that we need sharpened, that it's whatever trial that we're going through, that we can use what we're learning in our knowledge to hopefully benefit others. And this quote by Dr. Seuss we have hanging up in our house. And it says, "Unless someone like you cares a whole awful lot, nothing's going to get better. It's not." And this picture that I have was on March 1st last year. We had our march on the Capitol on March 1st of last year. And this is when the change happened with Medicaid. So it was our first year with the rollouts. And these kids cared a whole lot. Many of these kids traveled from outside of Austin, and they came with their home health nurses. They came with their oxygen tanks. They came with their central lines. They came with their infusions. And so they cared a whole awful lot. It takes a lot for them to even get out of their home to travel. And they came to show how much Medicaid meant to them. They showed that any of these changes could be detrimental to their life. And unfortunately, it has been very detrimental to many families. I'm part of a group called Protect Texas Fragile Kids. That's for kids that are on Medicaid and their families, and helps them navigate the system as to, if they're denied Medicaid, how to reapply. If you believe that your child is qualifies for Medicaid and you want to know how to apply to that process, Protect Texas Fragile Kids can help you along that way to understand how to apply for Medicaid. It is a closed group. It's private to protect any confidential medical information on there, but it's been very good to work with other medically fragile families and to understand that you're not alone. The ethical challenges, what working with Protect Texas Fragile Kids is to really not make it a political statement. I believe healthcare is a moral issue, that we're not trying to advocate on behalf of Republican or Democrat or really make it a political issue, but really trying to make it a moral issue. That you can be born a Democrat or a Republican family, that disability does not discriminate, that you can be born into a wealthy family or a poor family, and that it really is for what I believe is, we're very much a pro-life organization with Protect Texas Fragile Kids, that we believe that healthcare is from womb to tomb, and that we do not believe in late-term abortion, as that's something that many kids with these complex diagnoses that are diagnosed in utero are often offered late-term abortion. And I think that when you come from a family that has chosen to go forward with complex diagnoses, that you're very pro-life and you want that to come across. And so those are just some pictures of some of the medical supplies that we've had delivered, and to show that we have so much medical equipment, and then what it all goes towards. But we have a very good quality of life, and he has a very good support network, and that's what we've been able to develop, and that's what we're most proud of, is we've had a lot of support, and we couldn't have done it with all the support that we have. And that's who I try to show is really the whole community that has come together, that has made our quality of life as good as it is. And so this is where I end the presentation. We're a little bit early, but this was also well, it was first grade, and so he's now in third grade. So it was 2 years ago where Hayden got his Make-A-Wish. He has, as far as I know, in Texas, the first accessible treehouse where anyone with any mobility impairment can come play in our treehouse. And we love that. And we offer all the play dates, and Hayden invites everyone that would want to join him in his treehouse to come out and play with him at any time. So this is also our blog that we keep up to date on his medical treatments. We've scheduled number 23 in May for surgery number 23, but all the 22 surgeries that he's undergone, that's how I keep track of it, is on his blog for anyone that wants to follow. It's public. We have not made it private for those people that are out of the country. We've been contacted from Argentina, Australia, and Venezuela that don't have the same access to healthcare that we have in the United States. Oh, and Mexico. So that's why we keep our story very public, even though we'd like to be private. When you're rare, I think I want to share and give other advice. So thank you so much. I think that concludes my presentation.
Thank you, Adrienne. Sorry, I had to unmute myself. That was amazing. I had no idea about a lot of that. So especially with the rare diseases, when you're diagnosed with a rare disease, you have nowhere, really truly have nowhere to go because of the HIPAA laws. So are there 3 takeaways that you would give?
I would say that, as I had mentioned, that there's advocacy just doesn't ever end, and to really educate yourself on how to get involved in that advocacy. I know that CC4C works with NORD, and to really try to advocate with as many different avenues that you can through CC4C with NORD, and then also to really search out your best advocates. You, as I mentioned, you're your best advocate, but to search out social workers, specifically hospital social workers. They can help to turn you on to so many different avenues that maybe you don't know and are not aware of. But through your advocacy, to keep sharing your story. I think because when we're rare, we don't think anyone will relate to us, but that will connect other families and just really help build knowledge bases and then possibly inspire new research. So it's really to advocate, find help, and to share your story.
Great. Thank you so much. This is very informative, and I know a lot of people will benefit from it. So thank you for taking the time and giving us such a great presentation.
All right. Thank you for having me. Thank you, CC4C, and all that you do for us. We're loving it.
Well, we love that we can help you. So to end the meeting, I'm going to have, I don't know if Maria is still on, but she can stop the recording. If you want to leave the meeting, there is a little button down to the right. It says leave meeting. So you